Welcome everyone. Today we are presenting the work done within the WPC Technology Working Group. Our group goals were to explore existing technology that could improve life with Parkinson's and to promote innovative action. Our mission was to find areas of improvement that respond to unmet needs, which we would promote to the Leadership Forum as a technology project. Technology has the potential to enhance all levels of care of people living with Parkinson's disease. Connectivity between the home environment and clinical specialists, wearable devices that objectively monitor behavior of people with Parkinson's outside of the traditional clinical setting, and technology-assisted delivery of rehabilitation are just some examples. Further, technology can minimize barriers to equality of care by eliminating geographic isolation, which many people with Parkinson's experience when they do not have access to Parkinson's specialists, such as physicians, nurses, psychologists, speech, physical and occupational therapists, social workers, or even support group networks. Despite the numerous benefits that technology can offer people living with Parkinson's disease, there is no centralized location that catalogues existing technologies, and no consensus on what technology works best. As a result, many people living with Parkinson's do not know what potential options exist or how to access it. Researchers and companies looking to innovate technology may duplicate efforts for services or devices that already exist, and opportunities for collaboration to build upon or improve existing technologies may be missed due to lack of awareness of other technology efforts. Further, the vast numbers of different technologies across diagnosis, clinical monitoring, telehealth platforms, wearable devices, technology-guided rehabilitation and exercise programs make it daunting to know where to begin.
Together with the progress of the development of smaller and more powerful devices and the spread of high-speed data access services and communications infrastructure, new possibilities are emerging to develop applications capable of delivering better and enhanced healthcare to a potentially wider public. The need to reduce physical presence and the periodical lockdowns and movement restrictions due to COVID-19 pandemic have boosted the need of implementing existing technology or developing new components able to reach more people than ever before. The core values that drive our proposal are that we want to be able to reach and serve more people, save time, increase contacts with specialists, and reduce isolation in people with Parkinson's. We propose that the varied types of technology which need to be explored further should be accessible, scalable, modular, mobile, and be able to integrate services from different healthcare providers and data from different sources. We propose that we do not start from scratch, but rather we adapt, improve, and update existing technology. At the core of our proposal, we want to be able to identify, collect information, categorize it, and make it accessible to the public in the shape of a catalog of existing tools that can fit people with Parkinson's needs. The information we will look to collect will be gathered from all the stakeholders, including, and at the center, will be people with Parkinson's and their families, healthcare professionals, and Parkinson's organizations. Once we gather this information, we propose to configure a task force composed by a group of experts in 4 main areas of remote patient care and assist to describe the needs for bringing Parkinson's remote management to the next level. Clinical evaluation, continuous measurement, therapy deployment, and people relationship management. The third step will be to compare the needs, description, and data collected with the technology available to identify and describe the gap between the functionality required and the state of the art. We think the focus of the community should be the value we could add to the Parkinson's community through this work, and ultimately focusing on those unmet needs, but also on marrying the needs to what is already in existence. A survey circulated to all the World Parkinson Congress working groups helped us to understand how people were using technology in relation to Parkinson's, mainly by collecting data from Parkinson's organizations. The top-line results revealed the following. Organizations feel that people with Parkinson's in their community use technology to access educational programs and support via social media, and to make use of telemedicine. Organizations use technology primarily to reach members through social media, provide educational programming online, and run online support groups or other social gatherings. Organizations feel that technology, new or available, can improve the Parkinson's community by reducing isolation among people with Parkinson's and care partners, enabling access to healthcare providers through telehealth, having more reach for their organization's programs, and more symptoms management or tracking of symptoms. Following this, we began to meet with different companies who had some kind of technology related to Parkinson's. These were companies of various sizes, introducing different kinds of technologies for different outcomes and uses. Each one was so different, and it became clear that we needed to align this back to our targets and values. So the group designed an internal survey to help us do this, and these were the key outcomes. We are interested in a technology that serves both the underserved populations and those with technology which is readily available. We think technologies used for early detection of Parkinson's and those used to track progression of symptoms would be the most beneficial. However, we would also like to look at those targeting patient symptom management and quality of life enhancers. And lastly, the technology helps with DBS setup and fine-tuning. However, this was not prioritized among the others. We would like to partner with both a startup company and/or established technology firms, as we feel both have significant benefits and may fill an unmet need. Our preference would be to work with an existing technology that can be adapted to our goals, or a mature product that we can improve within the Parkinson's community rather than an early stage product. We would be looking to evaluate the technology based primarily on efficacy and strategic fit with our goals and mission, but we will also evaluate based on service delivery, safety, training needed, accessibility, and sustainability. The need for physical distancing in the past year has led to the rapid adoption of telehealth solutions globally. However, as we well know, the use and benefits of technology in healthcare are not specific to the current pandemic. Here are some of the major streams for which we feel technology can have a positive impact. Those who live in remote or rural areas may have limited access to specialized healthcare services, potentially leading to an increase in morbidity and mortality. Long delays or complete inaccessibility to primary and specialty care are common across larger states where the population is concentrated in urban environments. Elderly, racial, and ethnic minorities, socioeconomically disadvantaged, and individuals with chronic health conditions disproportionately experience greater specialty care access challenges and poorer health outcomes, despite geographic residence, especially in medically underserved urban and rural areas. Patient perceives stigma or clinician discrimination about a medical condition or service. Implementing chronic disease remote management eventually can provide a positive solution in any of these areas.
Our target audience is varied, includes people with Parkinson's, healthcare professionals, therapists, researchers, clinical trials, and organizations. Not only can technology help individuals, but the data that such technology can collect play an important role in research studies, as well as pulling together invaluable information for people with Parkinson's and their families. Evidence that we need to support phase 1 of this work is to gather information via survey data from the members of the WPC working groups regarding 1. Agreement of the greatest need of initial focus, and 2. Input of information others may have of technologies that are currently available for these target areas. This survey would include questions related to the following topics. Topic 1. Agreement on the population of focus. For example, underserved populations who might not have ready access to doctors and therapists, and thus could benefit most from technologies which allow for remote services. Agreement on the identified technologies of most benefit for early detection of PD, allowing for early intervention and education, for tracking progression of symptoms, allowing for more continuity of care, and for patient symptom management and quality of life answers. Ask WPC partner groups to share information regarding existing technology that can be adapted to our goals or a mature product that we can improve within the PD community. Once we have obtained this information, it will allow us to move on to the next phases of focus, which are to evaluate the available technologies using criteria of efficacy and strategic fit with our goals and mission, evaluation based on service delivery, which includes safety, training needs, accessibility, and sustainability.
Challenges we feel we'll face. The pressures to adopt telehealth solutions to support self-management have been growing, largely because of the increasing number of patients with chronic diseases. This has created a growing challenge for healthcare systems, with more complex care requirements resulting in greater costs. A major challenge for sustainable telehealth programs is related to funding. Despite the considerable funds being directed towards the purchase and maintenance of telehealth equipment and infrastructure, there is very limited investment in formal evaluation. Poor research funding equates to a lack of quantitative evidence to support telehealth. And ironically, the lack of evidence is often considered the reason many organizations are reluctant to provide long-term funding. The pandemic has forced individuals and healthcare systems to review what is possible and desirable and to adopt models of care to the rapidly evolving situation. Many countries have seen a shift towards telephone and video consultations. Patients have been sent home with devices such as pulse oximeters and instructions on self-management to minimize the load on healthcare systems. Some hospitals have introduced robots and tablet computers to facilitate physical distancing while monitoring and communicating with patients. The cost of these devices is falling, and an almost unlimited amount of data can now be stored and analyzed. Novel methods of capturing, curating, and analyzing data are being developed. However, telehealth is not just about technology. Delivery of telehealth also requires changes in working practices and curating data. As an added challenge, telehealth comes with risks, including exacerbating the digital divide, poor software engineering, and security breaches. Future telehealth platforms must be secure, reliable, and flexible enough to accommodate regulatory, professional, and healthcare organizations' requirements. Patients need to be aware of the privacy choices they are making to ensure data security and avoid disclosure of sensitive personal information. To optimize digital inclusion, telehealth solutions must be easy to use and maintain. This includes availability of good internet communications. In envisioning a telehealth-enabled future, one must remember that many clinical conditions require physical examinations or interventions, and that care is a human and relational activity. To date, investment has been insufficient in developing technologies that work for clinicians and patients, and adapting healthcare systems and lifestyles to fully exploit these technologies. How easy, realistic is this project? Well, early phases of this project will require very few resources. Once information is received regarding the types of potential technologies that might be available to address the needs of underserved populations, the tech working group would evaluate a technology of focus using the above stated criteria. Once the technology is selected, more resources, including a higher level of partnership, would be required to adapt the technology to the needs of the Parkinson community and to increase accessibility to the technology.